Hey everybody, it's Allie from Padfoot Palms, Poodles, and Pals, and I wanted to show you a shirt that I got for Christmas, future stay-at-home dog mom. So, I am making this live session today because I wanted to talk to you guys about my experience that I had at the vet yesterday. So I ended up taking Sega to the vet because she has just a very small wound at the end of her tail. It looks like one of the puppies may have been, overly rambunctious while playing with her because, if you've had puppies and older dogs, you know that they have a tendency to pull on tails. So Sega is fine. It's a very small wound, but I wanted to make sure that the vet checked it because, as many of you know, a lot of poodles have docked tails, which of course Sega does, and I didn't want it to become infected or, the skin is very thin there. So anyway, I just wanted to have the vet check it out. She's fine. Sega's good. So when I took her to the vet, one of the things that the vet and I ended up having a very long and uncomfortable conversation about was the lepto shot. So because she was there, they wanted to give her the lepto shot, which, as if any of you have been a member of our Facebook group for any length of time, you know that I am not a fan of this non-core shot. So he asked me, he said, so I see, in her records, because this is actually our reproductive vet that we ended up taking her to. Side note, that's why it's really important to have more than one vet that you can take your dog to. We couldn't get her in with our regular vet who's close by for another 2 weeks. And I wasn't interested in leaving a potential open wound for 2 weeks before we could get her in. So I had called my reproductive vet and they could get her in 2 days. So it's a further drive, but anyway, we got her in sooner. So he asked me, he said, hey, I'm looking at her shot records and I see that she doesn't have the lepto shot. Can I ask why? And I said, sure, you can ask why, because he knows me. So he knows this is going to be a conversation. And I explained to him that the lepto shot has had a lot of really horrible adverse reactions, including death, including, severe site swelling, amputation of limbs close to the injection site, right? It's been bad. Significantly worse than, adverse reactions to, say, core shots, which is usually, nausea, vomiting, swelling of the injection site, things like that. Those are more standard vaccine reactions. Not to say that they're good or acceptable, but it's kind of one of those things that, there's a possibility it could happen. The lepto vaccine, the reactions are significantly worse. So I explained this to him, and I said that my dogs are not at high risk of coming across leptospirosis. So I have decided through my research that, when offered this non-core shot, that I would politely decline. So he was like, yeah, so the lepto shot, it got a really bad rap. And there's actually a new one out, and it's doing a lot better. So, if you wanted to do that one, we could do that while she's here. Now, mind you, because of COVID, and this is a non-urgent case, they did take her inside, and I'm waiting out in the car. For urgent cases, I insist that I'm in the office with the dog, but Sega is so laid back and so sweet. She's fine. And this is a very trivial wound. So I opted to, just not push it and stay in the car. So I'm on the phone with the vet. And I told him, I said, oh, well, this is the first I'm hearing that there's a new version of the lepto vaccine. So I'm afraid that I'm going to need to research this because I'm not comfortable giving a new vaccine and my dog being a guinea pig. And he was like, well, what do you mean? I mean, it's been on the market for, at least 6 months now, and dogs are doing fine. So here is what you need to know about dog vaccines, adverse reactions, and vets. And it's just information to keep in the back of your mind. I'm not anti-vet. I think vets are phenomenal. We love our vets. And while I get frustrated with our vets when we have these type of conversations, it doesn't make me respect them any less. It just means that there are certain things that I take what they say with a grain of salt, which is what I encourage all of you to do. So he said, oh yeah, well, it's been on the market for a few months and it's been fine. And I said, okay, with the original lepto shot version, do you know how long it was on the market and all these dogs were having these severe adverse reactions and dying? Because I don't count that as an adverse reaction. I count that as, holy crap, that's terrible. How long was it on the market before they created a new version? And he was like, well, it took them about 8 to 12 months to collect all of the data, review everything, and then start a new vaccine. So almost a year to a year, dogs were getting the vaccine, having horrible reactions, some even dying, dogs having limbs amputated, horrible, people where the dogs didn't pass away. I mean, they're accumulating these horrible, huge vet bills, right? Trying to save their dog. So I was like, okay, so explain to me why you think my dog should be part of this experimental time of this new vaccine. And he was like, no, they do testing before they release the vaccine. Yes, but you just told me that it took them 8 months to a year to collect all of the data to then start to work on another vaccine, which, by the way, they continued to give the original vaccine that was causing all the problems. They didn't just take it off the market and stop. They kept giving it. Meanwhile, they're pulling in all the data and researching and all of this. And I was like, so you're saying the new version hasn't been out for a year yet, and you want my dog to be part of an experimental group that then gets this vaccine? Can you tell me why? And he was quiet. And he said, well, I don't have an answer for you. And I said, okay, fair enough. I appreciate your honesty. So with that being said, I understand why you're telling me about the lepto vaccine and you're encouraging me to get it. However, I know that my dogs are, at this point with this whole COVID thing, I mean, they're basically either in my yard, in my house, or we go up to, Home Depot for socialization. We go to Lowe's for socialization, right? We're not even going to PetSmart. So their risk is very, very low. And he said, well, okay, I understand that the risk is low. I'm just required to go over it with you so I can check this little box on my form saying that we discussed it, because lepto is something that can be transferred to humans. right? And this is the same conversation that they have about the rabies shot. The whole reason why you are legally required to get a rabies shot is because it can be very problematic if spread to a person, and treatment for a dog can be unsuccessful. So lepto is kind of in that same realm of it can be transferred to humans, therefore we push people very hard to get it. So, like I said earlier, this is the first I had heard of a new version of the lepto shot. So I started doing my research and going on to the vaccine company's website and trying to find the information about the study that they did where they tested the vaccine on 700 dogs was like pulling teeth. You would go, they would indicate that there was a study, right? They would reference it all over the place because they want you to know that they did a study. But then when you go to try to find the study, they don't link it. They link everything else, but they don't link the study. And when you go to try to find it on their website, it keeps taking you to another link with a whole bunch of articles about why the lepto shot is so good, right? And for your average pet parent, this is going to be frustrating enough that they just give up, right? Because we're all busy, we have things to do, and so trying to find out where this study is that they did and what kind of reactions they had. I mean, I was at it for almost an hour and a half this morning and couldn't find it anywhere through the vaccine website. So I was just like, okay, well, I mean, we've been at this for a while now. Let's just go ahead and make breakfast because life goes on, right? So the reason why I wanted to share this experience with everyone is because there is nothing wrong with saying no. There's nothing wrong with telling your vet, you know what? I'm not familiar with this procedure. I'm not familiar with this vaccine. I'm not familiar with this medication, so I'm going to decline it at this time so that I can do my research and figure out what I want to do. There's nothing wrong with saying that. That's part of being a responsible pet owner. You are your dog's health advocate. They can't tell you, hey, Mom, this shot makes me feel terrible. Right? They can't tell you. They're relying on you to put in the effort, to do the research, and to make an educated choice, right? And that's what it is. It's a choice. Because in most places, at least in the United States, dogs are considered property. So your vet can't require you to get a rabies shot. They can't require you to get puppy shots. They can't require you to get a lepto shot. They can advise you, they can mark it in their little chart that you declined it, but they can't make you do it. They can't give the shot without your permission, right? So part of why it's challenging for pet parents is because we have been conditioned to always do what the doctor says, right? And again, I don't want you to think I'm bashing vets because I'm not. I have a huge amount of respect for them. It is a field where they are required to be, 4 or 5 different professionals all rolled into one, right? I mean, they're a general practitioner, right? You bring your dog in when they get a cold. They are a surgeon. They're doing surgeries on your dog, fixing broken legs, spay and neuter. They're required to be a nutritionist, which they have minimal training on, right? And a whole slew of other things. So I feel for them because it's a profession where they're stretched so thin. But it's really, really important that as a pet parent, you are confident in yourself, and you are confident enough to say, hey, you know what, doc? I don't know. I don't know about this shot. I've heard things that are unnerving. And so before we get it, I need to do my research. So I'm going to decline it at this time, but let's talk about it at our next visit. There's nothing wrong with saying that. And any vet who bullies you, who pressures you, who tries to make you sound like you're a bad pet parent for saying that, and I mean this with all sincerity, from the bottom of my heart, do not give them any more of your money. It is a service industry. They are working for you. They work for you. You bring your dog in and say, fix my dog. So if they're not doing their job, if they're not willing to work with you, if they are insistent on speaking to you in a condescending manner, or making you feel bad, or making you feel like you don't know what you're talking about, or that taking the time to go research something makes you a horrible pet parent, then don't you dare ever go back to that vet ever again. And there is nothing wrong with that. Side note, if that happens at your regular doctor as well, please don't go see them either. But specifically, I'm talking about vets. So you want a vet that's going to work with you, right? And be part of your healthcare team, because you are your dog's healthcare team. You are. You are providing them with the best possible food that you can, supplementing them if you feel like something could be better or that you want to do better by them, providing them with fresh, clean water, giving them nutritious treats and bones. Your dog relies on you for everything, right? And we as pet parents, we take a lot of pride in that. And I want you to just take that next step and be that confident pet parent that I know that you are when I see you guys commenting in the group and helping each other. Be that confident pet parent when you go into your vet. Because if I was not who I am when I went into the vet yesterday, if I was just some Joe Schmo who didn't know anything about vaccines, and I was like, hey, Dr. Bob, I heard some bad stuff about this lepto vaccine. And the doctor was like, oh, no, don't worry about it, because there's a new one out and it's better. So let's go ahead and charge you $20 for that $3 vaccine, and let's go ahead and give it to your dog. And if I was that Joe Schmo, that's what I would have done. And that's what the majority of people do. Mostly because they don't know any better. And I don't hold that against them. But in our group, education is key. So I wanted to share my experience with you, talk a little bit about the frustrations of trying to research these vaccines and things like that they don't want you to know, all of the adverse reactions and things that can happen, but you really need to know. I need to know, of those 700 dogs that they tested, how many died. I need to know how many had adverse reactions, how many had amputations, how many had reactions that weren't reported. What is the instance of vaccine reactions that are being recorded as something else and not a vaccine reaction? That's all the information that you need to make an educated choice. So, thank you for sticking with me while I was on my soapbox. I feel like it's important to share these experiences with you guys, because there are so many people that post in so many dog groups, and they're being pressured by their vet to do things, and then they're kind of panicking afterwards well, my vet told me to do it, but now all these people are telling me it's bad. So I'm here to tell you, if anything happens at your vet's office that you're not sure about, just politely decline. It's okay. It's not the end of the world. Your vet should not bite your head off about it. It's a good thing. So, okay, I see that there were some comments here, so let me kind of scroll back up. And, okay, Allison said, inform yourself since no one else will. We are their voice. Absolutely. Yes, we are. As pet parents, that's part of what you sign up for. When you take their life into your hands and into your family, they're relying on you to be their voice. Allison, you're 100,000,000% correct. So yeah, thank you for that. Okay. Robin's got a question, just a quick question, and not to get off the dog topic, but I feel the same about vaccines and my kids. So what is your honest opinion on the COVID vaccine? You're right, that's not a dog topic. Robin, you're fired. So, as far as vaccines for children, for people, for COVID, right? I think that the same mentality should apply. You have got to do your research. The information is out there. They may or may not have it readily available. I do find that researching vaccines for humans, they tend to have it more readily available. So I don't know if it's because of legal reasons or whatnot. So if you are concerned about vaccines for your kids, or specifically the COVID vaccine, then you know what you got to do. You got to get on there and you got to research it, right? So I have not, we don't have access to the COVID vaccine right now where I live. So I have not started to research it, but it is something that I will be researching and taking a look at. And as with anything, there are pros and cons, right? There's a risk. So you just have to look at the data, all of the information that you can possibly find from reliable sources, right? I'm not saying go get on, crunchy hippie mama group where they're all anti-vaccine and ask them, hey, what do you guys think about this vaccine, right? Because you're going to get very biased response. Just like if you went to a pro-vaccine group, right, you would get a very biased response. So you have to do your research, weigh the pros and cons, and then decide what's best, Robin, in your case, for you and your family. So, and that's what I'll be doing, and I encourage everyone to do the same. And that's what I do with dog vaccines. It's the same thing. So nothing is going to be 100% perfect. There are going to be adverse reactions. Just like when you see those pharmaceutical commercials and it's like, take this pill for, what you need and it'll fix everything. And then at the end, it's like some of the adverse reactions are diarrhea, blurry vision, seizures, may become cross-eyed, deafness, right? Lameness, you may have a limp, right? It's like this whole big long list of small print of stuff that can go wrong. So if you need that medication for an ailment that you have to weigh the pros and cons. You have to do the research. And the same is true of vaccines. So, okay, let's see what everybody else said. Thank you for all of your knowledge. Love you and this group. Thank you so much, Michelle. I feel like it's important that everyone have a voice, right? And that's part of why I like to share my experience both in our Facebook group and on my YouTube channel, because so much of everything that we do with our dogs is behind closed doors, right? And there's so little information where people are just openly saying, hey, this is what I do, or this is what happened to me, unless it's something terrible, right? If it's something terrible, then everybody takes to Facebook and they're like, this is so bad, my vet made me mad, my groomer shaved my dog, right? But you got to have that kind of balance. So you're very welcome. And thank you for being part of it. Okay, Sabrina said, what age would you fix a mini golden doodle? My daughter's is 7 months. Okay, so with any dog, regardless of breed or size, I recommend that you wait until at least 2 years. Now, having said that, if you are interested in finding a vet in your area, you may have to drive just a little bit further than you would for, say, your local vet. You can do an ovary sparing spay, which you could have done at any time. And what that does is removes the uterus, right? So there's no risk of pyometra, but it leaves the ovaries. So your dog can continue to grow normally, to maintain their hormone level, right? But they can't become pregnant. So if that is a concern for you, if it's a concern for you that your dog, maybe you let them out in the yard for a couple of hours a day and you're not supervising them, right? Then that might be a better option for you. And like I said, you could have that done at any time. What I recommend for an ovary sparing spay is that you wait until after the first heat for a female. This is because when a female goes through her first heat cycle, her vulva is going to enlarge. And what ends up happening is it enlarges to the adult size, right? So unfortunately, what people do a lot of times is they get their dog spayed before they're even a year old, right? Before they have that first heat cycle. And what ends up happening is that the vulva never swells to its adult size, and it always remains the tiny infant size. That can be very problematic. That leads to urinary incontinence. That leads to UTIs, right? It's basically like if you were a full-grown adult, but your body parts were that of an infant, right? It wouldn't match up with your body. The same thing happens with female dogs. So I always recommend that you go through that first heat cycle. It's not nearly as bad as everybody thinks it is. I think that the whole spay and neuter movement just made it out like a female dog going through heat was some terrible, horrible thing, and oh my God, the dogs are, gonna come from the whole neighborhood and they're gonna come around your house and they're all gonna be waiting for her to come outside, right? And she's gonna be an emotional wreck and there's gonna be blood everywhere, all over your house, everything will be ruined, right? That could not be further from the truth. It's really not a big deal. It's really very easy to deal with. The dogs are not going to be swarming your house. I promise. It's going to be okay. So I highly recommend that if you're going to do a traditional spay, regardless of the dog's size, regardless of the breed, that you wait until 2 years. If you can't do that and you want to do an ovary sparing spay so that you've got, that protection a little bit sooner, then you could absolutely do that after her first heat cycle. So that's what I recommend. And you'll hear a lot of vets and breeders nowadays that are saying, oh yeah, well, that only applies to large breeds. So this kind of thought process for me runs along the same thought process as dog food companies who make dog food that is breed specific. It makes no sense. There's no science behind it. In the case of the dog foods, a lot of times they're all the same. They're just putting a different dog on the package and saying it's for Chihuahuas and Pomeranians and Jack Russells, but the food is exactly the same, right? So this idea that a spay or neuter should be postponed until 2 years is only relevant to large breeds. Small breeds still need their hormones. Small breeds, medium breeds, they still need those hormones to complete growing. The larger breed dogs do not have different anatomy. They do not have different hormones. They just grow at a different rate. But the idea, the basic science behind it is the same. If it's a dog, the science is the same. Whether they are a 2-pound Chihuahua or a 115-pound Great Dane. For both cases, you should wait until they're 2 years. So, you're very welcome, Sabrina. I'm happy to help. I just like to throw that extra bit in there because, I see a lot of people that are saying, oh, what kind of dog do you have? Okay, then you should wait 2 years. Oh, you have a little dog? Oh no, you could do that at 6 months. And that's not the way it goes. That's not accurate. I know that there's even like an infographic chart. I actually saved it on my phone when I saw it, where you can look up your breed on the left-hand side, and then on the right-hand side it tells you at what point you should get them spayed or neutered. If I made an infographic like that, it would be so much easier for everybody because it would list all of the breeds down this side, and then it would say 2 years at this side, and everybody would have a check mark. Why risk it? Why risk it? So my hope, I hope with all my heart, is that rescues will start to get on board with this because we're seeing more and more dogs with patella issues, with hip issues, with joint issues in general, which is really the main thing that happens when they're spayed and neutered too early. But there are so many other things, right? Like I was talking about the UTIs and incontinence. That is always the first thing I ask whenever somebody posts and they're like, oh, my dog's 9 months old and she's having all these problems. I'm like, okay, did you get her spayed? Well, you might as well take her back to the vet because that's called spay incontinence. I bet your vet didn't mention that to you before you got her spayed. Right? No, they just pressured you every time you brought your dog in. Okay, it's time to get her spayed. Okay, it's time to get her spayed. Ooh, the clock's running out. You better get her spayed, right? But they didn't tell you, oh, by the way, there's a really good chance that if you get her spayed, that she's going to have this thing called urinary incontinence. So your perfectly house-trained puppy that you worked so hard for now can't control it, because we did this unnecessary surgery, and now you're just going to have to deal with it. I would be willing to bet money they didn't tell you that part. And, and that makes me sad. So anyway, I'm sorry, I'll get off my soapbox. I've had lots of coffee this morning. I'm all amped up. Okay. Sabrina, by the way, that was a great question. Thank you for asking it. Okay. Allison said, take this for dry, itchy skin. Side effects include anal leakage and erectile dysfunction. Yes. Yeah, unfortunately, it's out of control. It's crazy. Some of these commercials, I'm just sitting there going, what? Why would anybody take that? But if you're in that position, right, you think, well, okay, well, maybe I could deal with some anal leakage. I got a problem. I got to fix it. So it's crazy. Okay, good. All right. Well, I hope that I provided you with some insight. I hope that I've encouraged you to be a responsible, confident pet parent. And if you're feeling like you're not so confident when you go to the vet, if you're feeling that you're pressured into doing things or making decisions, or they just take your dog to the back and they're like, okay, they're due for a shot, we're going to go ahead and do it, right? If you're feeling that way, I would absolutely encourage you to really research what it is that they're doing. What's coming up for your next set of puppy shots. Let's take a look at those before the appointment so that you can, right, say, hey, I don't want a 7-way or a 9-way shot. I want my puppy to have individual shots. I want to space them out, 3, 4, 5 weeks apart, because they're less likely to have a bad reaction that way, right? So when you are confident in what you know, then when you go to the vet, you can convey that information to them. And whether or not they fight you on it, there's nothing you can do about that. But just remember that they work for you. It's a service industry. You're not required to go there, right? You could go to any vet you choose. I have 3 different vets that I use for different things, right? So I encourage you always to research. I encourage you to be that advocate and that voice for your dog, because I know you can do it. I see your comments in the group. I see you guys helping each other. And I am here to support you both on your nutritional journey and, in this case, your journey to being a confident pet parent so that you can do best by your dog. Because it doesn't matter what anybody else says, nobody knows your dog like you do. Nobody. I don't. Your neighbor doesn't. Your vet doesn't, who sees your dog maybe once or twice a year. Nobody knows your dog like you do. So just keep that in mind. And good morning from Mississippi. Thank you, Stephanie. Good morning. Okay, if you guys are just jumping on here and you missed the whole first half of the video, don't panic, because I will be saving it and posting it to the group so you can just rewatch it. So if we don't have any other questions, I'm gonna jump off of here and finish out the rest of my morning chores. So I hope you guys are having a fantastic day. And like I said in my last video, I'm going to start doing a lot more of these live sessions. They may not be super long, right? Like this one this morning, but I'm going to try to do more live sessions because I know that people are really enjoying being able to jump on, learn something new, watch the recording, right, when it gets posted. And I'm going to start posting them both to our Facebook group and the YouTube channel. So however is convenient for you to view them, you'll be able to do that. Okay, so as always, thank you guys so much for tuning in. Thank you for being a part of the group and helping each other. And I hope that you have a wonderful day, and we'll see you in the next one. As always, be kind, rewind.